Welcome to slide 18. We're dealing with skin pigments now, and these are pigments that are found, of course, in the epidermis region of the skin. And we're focusing on our three main skin pigments in the human body. We have melanin, which gives you your beautiful dark skin, tanned skin look. If you have freckles or you have moles on your body, these are just pockets or accumulations of melanin. We also have an orange to yellow pigment in our body called keratin. And this is something that sounds like the word carrot. And guess what? Carrots also have keratin in them. That's what gives them their beautiful orange look. If you're looking for the perfect Halloween costume, since it's coming up, I've got something for you. You can just eat an extra abundance of carrots and you will temporarily turn orange. There you go. And lastly, hemoglobin, which refers to the reddish pigment of your blood showing through your skin. For example, if you're flushed or embarrassed because somebody said something that you didn't like or whatever, then you'll see the reddish pigment flush through the skin. In slide 19, I asked you to look up some things, but I'm going to go ahead and just spell them out for you. In this particular slide, there are exactly 6 things that I want you to focus on. And these are the 6 that I'd like you to write down the definitions of and to visualize and get a little more familiar with these things. These are things that you're likely to see in your patients. You're likely to have folks who are albino. They have a genetic lack of skin pigment, and so they have white hair, white skin, and pink eyes. You're likely to see from time to time someone who might be in cyanosis, which is the blueness of their skin or their nails due to low oxygen content or deficiency. Erythema is abnormal redness of the skin. If somebody has a super hot fever or they've been out in the hot weather or exercising a lot, they'll look very, very red to you. Hematoma is also known as a bruise. It's that purplish blotch underneath your skin, which is basically just a mass of clotted blood due to trauma. You might see some folks who are jaundiced. This is a yellowing of the skin or whites of the eyes. Sometimes this is due to liver malfunction or liver disease or pancreas disease. Sometimes liver cancer, for example. Sometimes hepatitis is another thing that you would expect to see a patient maybe jaundiced. And a lot of your patients are going to be having pallor. They're very pale in color because they're very sick, for example, so they look washed out. We also want to spend some time addressing appendages of the skin. And so we're going to be talking now about nails and sweat glands, oil glands, hair and hair follicles. And so the word appendages means basically things that stick out of us. It's a good way to say it. It's out of your integumentary system. So we're going to pause there and let you get caught up on those notes and we'll continue.